This is Dr. Soren. I'm going to talk about 6 myths and misconceptions about chronic pain. Myth number 1, pain is in your head. Now, pain is a very complex interaction between physical and emotional issues, and oftentimes people just get labeled like, hey, it's just in your head, just suck it up, get over it. But oftentimes there's very serious underlying conditions that are causing the pain. And while the emotional factors do play a role, that may amplify the pain. I look at it like a volume knob on your stereo receiver. So depending on your emotional state, that can really crank it up. But most of the time, there is an underlying physiological problem, and that's what we need to figure out and assess and treat the cause of it. Myth number 2, pain is a sign of tissue damage. Now, oftentimes there is tissue damage that causes the pain, but oftentimes there may be a nervous system issue, there may be stretch receptors, chemical interactions, spinal cord issues that may be causing this pain. So it's not just a pure sign of tissue damage to where you look at it and say, well, I don't see any damage. There's a lot more factors that can affect chronic pain. Myth number 3, the only effective treatment is pain medications. That's absolutely incorrect. There are lots of different ways of treating pain other than pain medications. While pain medications do play a role, there's a lot of ways of treating it through different interventions, through rest, through heat, ice, all different modalities, physical therapy, injection, steroids, all different methods of treating pain. So there are many more options than just opioids. Myth number 4, pain is a normal part of aging. That's not completely true. There's plenty of older people that have minimal pain or have no pain, and they're doing great. So oftentimes people, as they get older, they just say, well, I'm just getting old. But there may be a treatment for that. So that's where it's important to go ahead and look into what the cause of it is, because maybe there is a great treatment for it and you could live pain-free. Myth number 5, chronic pain is caused by injury or illness. Well, oftentimes there is an injury or illness, but many times there is no definitive injury. Sometimes it's wear and tear that does happen to us over time, but sometimes there's an underlying neurological condition. So there's lots of different things that you really need to go see a specialist or your doctor to really figure out what the underlying cause is, because it may be treated. And this leads us to myth number 6, pain is not treatable. That's absolutely false. Now, that's not 100% true that 100% of pain is treatable. And that doesn't mean you're going to be 100% pain-free. But most pain can be improved through the different methods, modalities that we have to use. So I would say absolutely false that pain is not treatable. There are many treatments, and you really don't know until you talk to your provider and figure out what the various options are. Thank you for listening. Have a great day.